Hey, everybody. Welcome to the She Found Motherhood podcast. It's Dr. Sarah here. Today, I have the pleasure of chatting with Mag. Mag is a physician who bravely shares her journey with infertility and pregnancy, complicated by an unexpected and devastating medical diagnosis. Mag will share her story right after this quick message. Welcome to the She Found Motherhood podcast. We are Doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Good morning, Mag. Welcome to the She Found Motherhood podcast.
Good morning.
Thank you so much for being here and for sharing your story with us.
Happy to.
So I just thought we would start. You can give us a little brief introduction about who you are and why you wanted to share with us.
Sounds good. So my name is Mag. I am mother to a beautiful 9-month-old daughter now, and I've had quite the journey to get to have my daughter with quite a complicated pregnancy and prenatal history as well. So I thought it might be good to share that.
Yeah, I think it really is. And like we were just saying before we started to record that we haven't shared a lot of stories that have had complicated pregnancies, but they happen. And I think it can be really scary and overwhelming. So I just want to say thank you before we even start for sharing and for helping other people feel less alone in their challenges. So why don't we go back, Mag, to when you decided that you wanted to have a family and how that journey started and how that.
That goes back a really long time.
Okay, we don't have to dig too deep into it.
Yeah, I won't go back to my birth, but my husband and I have been together for 16 years.
Yeah.
And really early in our relationship, we already were talking about having children and how both of us really wanted a big family, actually.
Yeah.
We did 4+ kids. We were young and we thought it would happen easily.
Mhm.
And as a physician, I had a really long training,
Mhm.
offices 3 times, countries 2 times. And so initially, we didn't really try very hard in terms of we weren't actively trying, monitoring cycles and everything. But we'd been on and off trying for 8 years before we got pregnant. So initially, it just looked like stopping contraception and trying.
Mhm.
That didn't work. Then I thought, oh, I'm very stressed. I have a very busy life. Let's start tracking things. Did that for a couple of years. That didn't work. And so we went through the IVF route in the end.
Mhm.
And I have endometriosis and I had a ruptured appendicitis. So
Oh my goodness.
I was told that my risk, and I have celiac disease. So I have many reasons to have issues with fertility. And so I was told that was probably the issue and that I would really definitely need to go through IVF. So we started the investigation. Of course, they found no clear reasons for the infertility. And so we went ahead, started the treatment. I had mild ovarian hyperstimulation syndrome with my IVF. So it was really a lot of pain, a lot of discomfort, but
Mhm.
we were so excited. So we went all steam ahead, really excited. We had good number of eggs, good retrieval, and we did fresh egg transfer.
Oh, wow. Yeah.
We got pregnant. Of course, this was 8 years coming. We were so excited. And then I had right away started having some spotting and some bleeding, and I was told everything was okay.
Mhm.
The HCG levels were going up. Everything looked good. Had multiple transvaginal ultrasounds. Everything looked good. And then went in for 8 weeks, which was going to be my last follow up at the fertility clinic before being transferred to OB/GYN. And then they told me the baby stopped growing.
Mm.
And it was a bit ironic because I'd actually stopped bleeding for a couple of weeks. And so I thought everything was good. And then the baby stopped growing. And of course, that was in 2021, the midst of COVID,
Mhm.
nobody allowed in. So I was alone at my ultrasound. I got the news. The IVF clinic actually was so good about it. They let my husband come up
Wow,
and
good.
be there with me, which was good. Then I was referred to the early pregnancy loss clinic or something like that.
Mhm.
And I was very fearful, very emotional. And there started my journey of realizing how important communication is.
Yeah.
And so the physician I had seen that time, I was really worried about getting pregnant again and what solution was going to be the best for
Yeah.
me, or
Yeah.
whether it was going to be just wait and see, or whether it's going to be like a medical approach or a surgical, like a DNC,
Mhm.
because I hadn't passed the fetal tissue, I needed something.
Yeah.
And the person was like, well, and I said to her, I often have all the complications.
Yeah.
Even when people tell me, like, I had already had the ovarian hyperstimulation, which is super rare. So I was quite a little bit worried. And she was like, oh, you're just too negative. You won't get pregnant again if you're not positive. And
Oh,
I was like, that's such a weird thing to say. And I was like,
yeah.
"Oh, like I'm grieving. I'm allowed to grieve. I'm allowed to cry. I'm
Yeah.
allowed to find this hard." Excuse the crying baby in the background. But I was like, "I'm allowed to grieve. I'm allowed to cry. I'm not being negative because I'm grieving and I'm crying. I'm just processing
Yeah.
and going at my own rhythm." And I remember telling her, I said, I'm a physician myself and I'm used to talk about really difficult topic and difficult conversation. And I feel like the way you're doing this is not good. I told her.
Did you? Good for you.
And she was like, "Oh, yeah, but it's different. You're a blah, blah, blah physician." I was like, "No, it's not different.
No.
Compassion and empathy, even if you've been doing this for 30 years and I've seen lots and lots of women have losses,
Mhm.
it still has to be." So, anyways, I won't spend too much time on this.
Yeah.
Otherwise, I'll speak for 3 hours. But then they wanted to do another follow up before booking the DNC, and they were giving me a date 2 months later, and I was like, I
2
couldn't.
months?
Yeah, it was like 6 weeks maybe, but
No,
it was
that's
really
too
far.
long. Yeah.
It was way too long, and I told them, I was like, "I cannot live like this. I
Mhm.
know I have a dead baby inside of me."
Right.
Like, to me, it was never just fetal tissue. It was a baby,
Mhm.
and it's our baby that we wanted to have for so long,
Mhm.
and we already loved so much,
Mhm.
right? And so I couldn't wait this long.
Mhm.
I needed closure. It needed to happen. And I was lucky in a way because I've had other health issues and palpitations and other things and didn't react well to anesthetics in the past. I actually needed to be done in the OR.
Mm.
And then once they figured that out, I was able to be seen pretty. But this being said, going through a DNC in the midst of COVID, my husband wasn't even allowed to bring me. He wasn't allowed to stay in the waiting room with me. They didn't have a waiting room anymore because patients aren't allowed to be close by. So they basically put a chair beside their lunchroom. And I sat there alone crying whilst people came in and out of the lunchroom and I could hear them eating and laughing. And it was just,
Mm.
I know people need to eat.
Yeah.
I
Totally.
know life goes on, but it just felt very disrespectful to my grief. Like, that was really hard. I just there's no other words than that. It was horrible.
It's so
Anyways, this happened, and then after that, I got endometritis, which is supposed to be super rare, but
it's so rare after DNC. I don't think I've ever seen it in my, like, 12 plus years.
yeah, so after it, I kept having lots of pain, lots of bleeding. I got better, then it got worse again, and I called them, I was like, "Was this normal?" Maybe I think they kept thinking that there was a psychological component to it, which it happens, right? Our psyche is really linked to our body, and I
Mhm.
wasn't doing well psychologically. I was grieving and I was struggling. But in the end, finally, I went to see the emergency physician, and then they diagnosed me with
Mhm.
endometritis, and they grew bacteria, and
Mhm.
it was full blown. That was the second time where I was really shocked a little bit by language
Mhm.
utilized by healthcare professional when they were taking the history and then the sentence that the the person uses, when did you get rid of it? Meaning, like, when did I have the DNC? And I think too, that was just horrible.
That's awful.
And then I really spoke up and I really advocated for myself. And I told the person, I said, no, this was a very much wanted pregnancy. It was a loved baby to us already. We didn't get rid of it. We miscarried. And she was like, oh, I'm sorry if I offended you. And I was like, no, I need you to realize that you would have offended anyone. Like, I
Totally.
need you to realize your words
Mhm.
were not appropriate and it's something you need to improve on. And she really didn't, the professional really didn't get it. So I said, well, then I requested somebody else because we are allowed not to suffer in silence.
Mm.
We're allowed to ask for care that's compassionate and respectful.
Mhm.
And if we're not getting that, and I can't emphasize that enough, we're allowed to speak up.
Mm.
We're allowed to request to be respected.
Good.
And
Yeah.
so I did ask. And then she came back and she said, oh, I had a few more questions. I said, no, you don't. I'd like to talk to your attending, your staff. I do not want to continue this conversation. Like, I've been crying for 30 minutes since you left the room, but I can't do this.
Good for you. And as a learner and as a resident, that will change her life, her course, she'll never forget that interaction for sure.
Yeah. And hopefully it changes for the better.
Yeah, I think it will. I think it will. Yeah, thank you, Mike, for advocating. That's so hard in that setting.
It is, but, and we'll talk a bit more about what came after
Mhm.
because it's a big one. But I think I've learned a lot as a physician going through this experience. I've learned a lot about the impact our words have
Mhm.
and the impact our demeanor has as well.
Mhm.
We all, none of us went into this profession wanting to be diminishing or disrespectful or anything. We want to be compassionate. We want to have empathy. And sometimes we just don't realize how our choice of words can impact.
Absolutely. So, yeah, so that's a rough start to your
Mhm.
pregnancy journey. After you had your endometritis treated, how did things go?
So I recovered
Yeah.
physically,
Yeah.
and as soon as I was physically ready, I decided to try again. And I think in retrospect, although I was physically ready, mentally I was
Mhm. Mm.
I was still grieving.
Mhm.
I was still very anxious the same thing was gonna happen again.
Of course.
But I went full steam ahead again. So we had frozen transfer of 2 embryos this time, and I got pregnant. And then at around 8 weeks again, I had massive hemorrhage. I
Mm.
was passing clots the size of tennis balls.
Oh my
Sorry
gosh.
to
No, that's a worrisome size.
Yeah,
Yeah.
exactly.
Yeah.
So
I'm always like, Looney Toony, don't care.
exactly. So it was very big, and so I for sure thought I had lost a pregnancy.
Mhm. Mhm.
And I went in and I actually lost one of the twos, but the
Mm.
other one hang on. So yeah, that was very sad, but very exciting at the same time. It was very ambivalent about how you're supposed to feel because
Yeah.
you've been wanting a baby for so long and you're pregnant, but you lost one of the embryos. So but it was okay. Like, I think overall I was just more excited than sad, if that makes sense, because I thought I had completely lost it.
Yeah.
So then I was pregnant. I had lots and lots of ultrasounds.
Mhm.
Like, for until 12 weeks, I had ultrasounds every week just
Mhm.
because of how high risk it was that I would lose the second embryo as
Yeah.
well.
Yeah.
And I didn't. And I had morning sickness, whatever, first trimester stuff. Nobody feels great then. And then I started feeling better at 16 weeks and I was really excited. We were planning for the future. We were about to put an offer in a house. Everything looked great.
Mhm.
And then at 17 weeks of pregnancy at 11:30 in the evening, I will always remember I was with a very sick patient and I was rubbing my neck in concentration thinking, and then I felt a lump. And it was in a location that's very high risk for cancer. And my training just kicked in.
Mm.
I had a sinking feeling, and I told myself, you have cancer.
Oh, Meg.
And I knew it. There was no doubt in my mind this was going to be cancer. But what kind of cancer? I didn't know. So right away, I actually went to the urgent care, like for pregnant women, not
Mhm.
the emergency. I saw the OBGYN, who also looked very concerned and said, come back in the morning and we'll have the internal medicine assess you. And I did come back in the morning and they said that I had 1 in 3 risk of this being cancerous, which actually was lower than what I was already in my mind. I thought this
Like
is
100%. Yeah.
so anyways, so then I was supposed to be booked to have an aspiration, but they booked it as an ultrasound. They made a mistake. Oh, I should say also in the meantime, I had x-rays done of my chest and they thought
Mhm.
it was also in my chest. And so it was like, it was a really stressful point. And I think it's hard being an healthcare professional and having the knowledge of what this could be. It's hard not to go to the worst scenario.
Mhm.
So I pushed really hard to have the test as fast as possible, which was difficult because, again, middle of a pandemic, everything
Mhm.
had played.
Mhm.
But in my mind, I was thinking, if it is a devastating diagnosis,
Mhm.
I'm now 17 plus weeks pregnant. I need to know,
Mhm.
right? And we need to make a decision.
Mhm.
So, long story short, had my first needle aspiration. It said it was gonna be some type of lymphoma, but didn't know which, or it was highly, like,
Suspicious.
high, very high risk, it's maybe
Yeah.
lymphoma. And then I fell between 2 chairs, and they referred me to a surgeon who was on call to get a biopsy done,
Mhm.
but he was too busy, and so he didn't have any place for 2 weeks
Mm.
to do it, and then that would have brought me right at 20 weeks, which is the cutoff if you need to
Mhm.
do a medical abortion.
Mhm.
So lots of phone calls, lots of trying to figure things out, transferred my file to another surgeon, then another,
Mhm.
and all of that in the end to learn that they could have just done another type of biopsy and radiology.
Mhm.
So finally saw a surgeon at 19 plus weeks. And then she referred me for another biopsy. And then I think third example of communication, being a physician, she started emailing me my results.
Mhm.
So I had a CT scan and then she emailed me and she said, yeah, there's cancer in your chest too. Not on those terms, in medical terms, but
No, but
she emailed me that on a Friday afternoon. And I was like, oh my God, what does that mean? So couldn't reach her, of course, because it's Friday afternoon and it's the weekend. Then after my biopsy, she said, the pathologist thinks it's T-cell lymphoma. And if anybody's medical here, just as a background, T-cell lymphoma, survival 10, 20%, horrible diagnosis. She said, but we're going to run more tests. You'll know next week. That was on a Friday afternoon.
gosh. And you're like 20 weeks pregnant at this point.
Exactly. I'm 20 weeks pregnant and I'm like, oh God. And sorry, like I should say, oh gosh, but I
It's
was
okay. We'll
really,
forgive you.
I remember this whole weekend, my husband and I were in bed crying. We didn't eat. We didn't sleep. We had Netflix on to try to change our mind,
Yeah.
but really we were just in bed crying the whole weekend. And then you start thinking, am I going to be able to have this baby? Am I going to survive? Is the baby going to survive? If I survive to have the baby, will I survive to see her grow? Will I get to be a mother? Will she grow up without a mom? Like you don't know. And so I wish, and I know if I had been a patient, she wouldn't have told me this may be diagnosis
While
whilst
they're
still going in. And I felt like I think there's a fine line between, I think as a physician, yes, we want to know, but we're patients. And
yeah.
and we need, and I don't know, I need, and maybe I shouldn't generalize, but I needed to be treated as a patient. And so she called me back the next week and told me I had Hodgkin's lymphoma. And I jumped with joy. And that sounds so weird. You definitely have cancer and you're like cheering. And I like called my mom right away. I called everybody and I told them, it's okay. It's Hodgkin lymphoma. And the reason I say it's okay is survival is 90%. So
Mm.
you went from 10, 20% chance of surviving to
Mhm.
90%. And to me, that was like the best news. And that lasted for about a day. And then I was like, but what now? Can I still have the baby? Can I still continue the pregnancy? Can I still? And this whole time, I was waiting for biopsy to be seen by oncology because they won't see you until then.
No, until you have a tissue diagnosis. Yeah, which is crazy.
So I saw them, and basically what I was told is there's not a lot of data. So
About
there's
treatment and pregnancy?
about treatment and pregnancy.
Yeah.
So there is some published studies, 20 people, 40 people at the most. So there was like less than 100 people overall who had been pregnant and had treatment that had been published anyways. And like 80% of them had a baby and the kids were healthy at birth. But what they couldn't tell me was what was going to be the
Yeah.
long term risk for the baby.
Yeah.
Like we know some of the medications we get for chemo can cause in the patients that receive them long term heart damage or lung damage.
Mhm.
We know that the risk of cancer when you have another cancer when you have chemotherapy is higher. And no one could tell me really what was the risk for the baby. They all said the studies look good. The longest follow up was 18 years and the babies look fine. And of course, I've read hundreds and thousands of studies.
Mhm.
I know how to read studies, but it's almost an impossible decision to make.
Oh my gosh, I was literally just thinking it's impossible.
It's impossible. And then the other side of it is what if
Yeah.
I wait to start treatment?
Mhm.
Then what? Then the best answer I could get was it's going to affect your survival.
Mhm.
How much? We can't tell because people don't wait. And then the other issue was, on top of it, the only way to stage this cancer is to get a PET scan. You can't do that when you're pregnant.
I've never
You
you just
can't.
can't.
There's just too much radiation. Even they had to do a CT scan of my chest, which is usually a big no-no when you're pregnant.
Mhm. Mhm.
And actually, when I went and they're like, any chance you're pregnant? I was like, yeah, I'm 20 weeks pregnant. And they're like, we can't do it. I was like, no,
To do it.
I
Yeah.
you have to do it, like, OBIM,
Mhm.
gynae, everybody has agreed this needs to happen. So,
Mhm.
you can't as a secretary tell me it's but yeah, so couldn't get the PET scan, so I couldn't have final staging.
Aging. Oh my god.
And so what they do in these cases is they assume it's advanced,
Mhm.
which means more intensive and longer treatment. So yeah, so stuck between a rock and a hard place. Do you accept that your own survival is going to be lower? Do you accept that there might be risk for your child that you're not sure? The consensus seemed to be that they treat pregnant women with this. The recommendation anyway was the usual treatment, which is
Mhm.
intensive chemotherapy plus or minus radiation. And then at that point, they were like, we'll send you the studies. You read them and you decide. And I was like, you need to realize that I can't.
No.
You need to treat me like a patient
Yeah.
and tell me what is your recommendation.
Yeah.
And I said that so many times and I called back and I called back because nobody was telling me what their recommendation would be. And I was just dying inside. It felt like such an impossible choice. And the time was passing and I was more and more pregnant and I just didn't know what to do. And so in the end, I said, you tell me what you would tell to any other patient
Mhm.
that wasn't a physician, who wasn't a physician. Excuse me, English is not my first language. So sometimes some of their preposition are.
You're very much forgiven, and there's no need to apologize, Meg.
And so she finally said, oh, then I would just tell you to have the treatment. I was like, okay, then that's what we're going to do. Right?
Totally.
But then my next question was, does chemotherapy cross the placenta? Does it go to the baby? And some of the drugs we knew did, but not in big concentration.
Mhm.
And some of them were unknown. So this whole pregnancy was just, okay, let's just get this baby to term
Yeah.
and let's hope she's going to be healthy.
Mhm.
And let's hope I survive.
Mhm.
And let's hope we get to grow together and I get to watch her grow and she gets to have a mommy.
Mm.
Because even though the prognosis was better, I still have a life limiting disease. I still can die and I just don't know. So we went on. I had my chemotherapy every 2 weeks, and it was as horrible as you can imagine being pregnant and on chemo.
Mm.
Uh, and every time I had chemotherapy, the baby stopped moving for 24 hours.
Oh, jeez, Meg.
And every time I ended up in the urgent care on monitors. At the beginning, I started chemo, I was only 22 weeks pregnant. So the first time it happened, they said, we can't do anything for you. The baby's not viable anyways. So let's just hope
Mhm.
thing pass and thing improve. And it did. You're going through this treatment to save your life. And you know that every time you're doing it, it clearly it affects your baby because she stops moving. And so it's just heartbreaking.
Mm.
It really is. And so many times I was like, I'm stopping. That's it. I'm stopping. It becomes when I started all this, she just started moving and I didn't even look very pregnant. And I was like, oh, I need to do everything for my survival. But the more the pregnancy went, the more my focus shifts.
Mhm.
And I felt the baby move and I felt her have hiccups and I was just like, I can't do this anymore. I can't have the risk of harming her. Yeah, so many times I came so close to quitting chemo and just saying, let's just have a baby and we can reassess after. Um, but I think I not just I think I was so lucky to have people around me and support.
Mhm.
My parents who live out of province,
Mhm.
we actually have no family in BC whatsoever. We both from far away. And And my parents moved in with us for a while. Actually, my mom stayed until the baby was 2 months old.
Yeah.
Story does have a happy ending, I promise. Must not forget that. But
Yeah.
yeah, we had support. And I also have fantastic colleagues who were there for me along the way. And it was nice to have people in my corner who also understand the medical issues.
Mm.
And they were like, no, you're not quitting. You keep
Yeah.
going.
Yeah.
You just do it. Like you've made a path and you just follow it. And I did. All my energy was just, you just do whatever you need to have this baby as healthy as possible.
Mhm.
And so I was sick, I was weak, I had bone pain.
Mm.
Most days I didn't feel like coming out of bed. Every time I had chemo for 3 days, I actually could not leave my bedroom and like bathroom. We have a lot of stairs at home. I couldn't even make it down the stairs for 3 days. So my husband, my parents would bring me meals in bed. I didn't want to eat, but I did because I was doing all this for the baby. And so
Mhm.
all of it for the baby.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
Yeah. So then kept doing that and then entered my third trimester. And then during third trimester after chemo, she did the not moving thing, but I also started having contractions after
Mm. Mhm.
starting at about 31 weeks. So that was stressful, but then you start to get used to it, right? You're like, you're going to get a contraction after chemo. You're going to end up again in the urgent care. I became a frequent flyer. I didn't even have to say anymore, I'm immunosuppressed. I need to be in it.
They're just like, "Oh, hi, Meg. Come on in."
Yeah. So that was all good. And then unfortunately at 38 weeks, because I had a lot of ultrasounds through all of this. And then at 38 weeks, the baby had stopped growing. So they had like in the last month been no fetal growth, which was actually one of the biggest risks with chemo was just IUGR, like
Mhm.
fetal growth retardation. So,
Mhm.
so technically, like she was still 50th percentile,
But she
but
hadn't grown.
but she hadn't grown,
Yeah.
and that was like really hard for me because then I felt like my body was failing her, that she wasn't getting what she needed anymore, and she couldn't grow. And actually, was it? No, it was at 37 weeks. Yeah, that she's still growing. And I just wanted her out because I was like, she's term,
Mhm.
right? She's 50th centile. We've made her grow till then. She's been like trooper through all this.
Mhm.
But now my body can't help her anymore. Like
Mhm.
she's not growing. So I thought she needs to come out. And they were like, no, it's fine. Just wait. But I don't know. She needs to come out. And I guess one part of this I didn't talk about, and it's a good segue to this, is how was I gonna I could barely go upstairs. I had so much weakness by then. Everything hurted. I was a cancer patient going through chemo and in my third trimester, which I hear for is not easy for anyone to be in the third trimester. So then what do you do? Do you try to deliver the baby? Or do you have a C-section? Or and it was super important too, and I should say that the baby she had to come at 38 weeks and 5 days because it had to be at least 2 weeks after my last chemo.
Oh, okay. Yeah.
And so and I had to finish a full cycle of chemo. So I had chemo at 36 weeks and 4 days. And so she had to come at 38 weeks and 4 days. So I knew that unless I was going to labor earlier, which I thought I was after each chemo, but never happened, I knew I was going to need to be induced. And they told me for a woman who has a first baby who's induced at 38 weeks, any woman, that the risk of requiring a C-section was about 40%. They said 30 to 40%, depending on the doctor I talked to. But they said, but you're so weak, your risk is probably higher than 50%. And so then I thought, do I want to go through all that comes with an induction? Because there's procedures, there's things required. It's not a regular birth either. And then they said, and even if you don't need a C-section, you will most likely need forceps or vacuums because you're just not strong enough. You just don't have the strength to go through a marathon like giving birth. But on the other hand, you can have a C-section. It will be planned, which decreases the risk of complications from C-section.
Yeah.
But because you're on chemotherapy and you're immunosuppressed, you probably won't heal very nicely from your C-section, or it will be harder to heal from your C-section and recover. So again, rock in a hard place. What do you do? I didn't know. I went back and forth and back and forth and back and forth for the longest time. And then I decided if I was going to go into labor naturally, like before my induction, I was just going to roll with it and try. But if I made it to 38 and a half week, I was going to have a C-section. So once the baby stopped growing at 37 weeks, I just wanted the baby out. But they said, no, let's just monitor you closely. I had to have hooked up to the monitor every day almost for a week. And then our fetal movement decreased. And then they were like, no, okay, you need an emergency C-section. So I went in for my emergency C-section. Like, to give you the background, I'm 1 week and 2 days post chemo. I'm still nauseous. I'm still not eating very much. I'm feeling generally gross as you do on chemotherapy. I'm a bit dehydrated, as you become when you don't eat or drink very well. And then at 2:00, at 10:00, they say, stop eating, stop drinking. And then I see the doctor and she said, we should do it around 4:00. And then it's July. It's the heat wave. The room is so hot. I'm sweating. And then no one can get an IV into me because I'm so dehydrated. And then time passes and now it's 8:00 at night. I still haven't had my C-section. I've had no fluids. I'm feeling gross. It was just it wasn't the best start to a birth, let's say.
Yeah. And to a surgery.
Exactly.
That's so hard on your body.
It was. And then so finally I was like, call someone. I need to have fluids. I felt like I was going to pass out. I felt so bad. This needs to happen. So anyways, got the IV, got the fluids, and then it's 8:30 and they said, we're ready for you in the OR. So I go in the OR and I am absolutely terrified of having any needles in my back. I've seen it done hundreds of times. I know they're very skilled in it. I know the risk of complication is really low. I know all of this, but I am absolutely terrified. I started being terrified about it before I got pregnant, about how am I going to get a spinal or an epidural. And it has no logic, but I'm just terrified. Blood work, no problem. Needles anywhere else, no problem. But a needle in my back where I cannot see it and I have no control over it, I just was terrified. But it needed to happen. And unfortunately, it did not go well.
Oh, Meg, of course it didn't.
Yeah. So very skilled anesthetist, no issues. But she put the needle in And then I got a big shock in my left leg and pain from like my hip to my toes
Mm.
and like numbness. And I didn't know this could happen. I'd never heard about it, but apparently it's not that uncommon. It happened. And then of course I jerked and she's like, oh, move. And I'm like, but the pain, but the numbness, like you. And then I got really hypotensive. Like that might be too much details, but like my blood pressure was 60 or something.
Yeah, very low blood pressure.
And I was like blacking out, like shaking
Mm.
and just feeling like in and out of consciousness for a bit while they were trying to give me drugs and everything to bring the pressure up. And then the spinal took and I couldn't feel my leg and then they started the surgery and everything. Unfortunately, my little one was really stuck in there
Mm.
and they had a really hard time getting her out. In the end, they had to have vacuum her out. And I remember there was like 3 people pushing at the top, just trying
Oh,
to.
it can happen. It's hard to get those little babies out.
Oh my goodness! Like people were like on stools.
Oh, man. I know, right?
And then like you feel actually, and I had seen this. Like I knew this was a possibility. I've seen it, right?
Yeah.
But to have it done to you, I felt like I couldn't breathe. I felt like people were crushing me physically. And I'm sorry, I don't want to scare anyone. Nobody crushed me. Like I was fine after. But while it was happening, I was like, oh my God, they're crushing me. They're crushing the baby. This is
Mhm.
awful. But yeah, they really struggled to get her out, but they did.
Mm.
And she's perfect.
Oh, of course she is, Meg.
Cried right away.
Good.
Beautiful baby. But I was still so like in and out of it. They tried to put her on my chest and I just couldn't hold her.
Yeah.
And that was so hard for me because by then, the spinal had worn off actually. And I kept saying, I'm in a lot of pain. And they were like, it's normal to feel pressure. And I was like, no, I'm in a lot of pain. But I was in pain. I was in and out of it. And I just couldn't hold her.
Mm.
And I remember I told my husband, you need to hold her. And I told the nurses, they were like, no, just hold her. And I was like, I can't. And I felt so much guilt for not being the one who was holding her when she was born. I just was able to hold her a few seconds and then they passed her to my husband and they had a wonderful skin to skin. But like for weeks after, I felt guilt. And I, in the first few days, struggled to bond with her. And I felt so much guilt after she was born about her going through chemo and being born to a mom who had cancer and being born to a mom who still was very weak, who was not able to be giving 100% of the care. And so I think to me, that was really hard. I don't know why, but I thought in my mind a C-section was going to be easy.
Mm.
Like to me, it was the easy option.
Yeah.
C-section is not.
It's not. It's hard. Birth is hard no matter how it happens.
Major surgery. And I think, yeah, I don't think I had realized that. But with all this being said, I actually recovered really well.
Good.
Everybody was like, it's going to take you forever. No, I was out of the hospital before she was 72 hours old. They had told me you probably will have to stay for a week just because of the risk of infection and your healing. But no, like I pushed through it. I think I had gone through so much already. I didn't want opioids. I didn't want anything. I pushed through it. I went home and kept pushing and pushing. And then I kept improving. Initially, like I was getting better. I was feeling better. Like for the first time in months, I was off chemo.
Yeah, were you done? Was that your last chemo?
I wasn't.
Like just
But I had like 2 weeks break
Yeah.
before starting again. So I felt great actually. Like it had been almost 4 weeks since my last chemo. I was feeling good. And then the bleeding started again. I was like, huh. And the soreness came back. I was like, huh. And I kept calling and asking, and they're like, no, as long as you're not changing your pad more than every 2 hours, it's fine, blah, blah. But then I started having pus coming from down there. So anyways, long story short, I had endometritis again, which delayed my chemo. And I'm saying this whole story in a very medical fashion. Right? I'm just counting what happened in just chronological order. And there's no words to describe how it felt. Like it felt because there was so many challenges and so many hurdles. And I didn't talk a lot about it, but I had to push so hard
Oh, mentally.
to
Yeah.
get the care. But I had to advocate so much for myself every step of the way. Even like chemo appointment kept getting missed, things got lost. There was so many times that I, despite being super sick, by being really pregnant, I kept having to push and advocate for myself. And that was really hard. It takes so much energy.
Yeah.
You don't realize the energy it takes on patients to just keep pushing and advocating for themselves and the emotional toll of everything that was going on. Yeah, it was hard. It was really hard. And people kept telling me, "Oh, you're so strong. You're so resilient." I was like, "No, I just have to go through it. I don't have a choice."
Yeah.
What are you talking about? What am I going to do? I have no choice.
Yeah.
This happened to me. This is the end I was dealt with. And just have to keep going, really. But yeah, despite all of that, and I want to say something positive, but despite all of that, I finished chemo after giving birth, 2 more months,
Hmm.
and I've been in remission since.
Oh, that's fantastic.
And I have a 9-month-old sassy, active, curious daughter.
You. Yeah, you
But
do.
she started crawling today.
Oh, Mag, that's amazing.
Yeah.
Wow. What a journey. Hey.
Yeah. And it's not. And I'm grateful and I'm happy. But I still have this weight on my shoulder and this sword over my head because I still go every 3 months to get checked. I still need imaging. And it's going to be a lifelong thing. And I'm, you know, so lucky that I was able to have my baby and I'm able to be a mother to her and I'm able to watch her grow. But I don't think I'll ever stop worrying about what happens if the cancer comes back. Yeah, that's bittersweet.
It is. Yeah, and I think it just highlights one sort of theme that kept coming back for me when you were sharing your story was how um as women, as pregnant people, as gestational carriers, we really struggle to put ourselves first, right? You almost didn't do chemotherapy, which is it, and this is the part that makes me crazy. Care providers, like the rad tech saying we can't do a CT scan on you. Maternal health I think that's the biggest theme from this story is that like good for you for making that impossible choice to do chemotherapy while pregnant.
Yeah, the guilt though. And you're going through it and you already feel so guilty.
Mhm,
And like for the CT scan, for example,
mhm,
that's just another example of the power of your words.
mhm,
You have somebody tell me you can't have a CT scan, you're pregnant, it's going to harm your baby. When you're already going through all of this
mhm,
and you're already feeling so much guilt.
mhm,
And it sounds like such a simple sentence. She didn't mean anything by it.
mhm.
She didn't want to make me feel bad or anything, but it did, right? And it was so hard for so long. Even after, I was like, oh my goodness, I've had a CT scan pregnant. I'm going through chemo pregnant, this poor baby. And, I was the person who was doing everything. I was like eating, as soon as I got pregnant, eating only bio, like doing everything I could, like
Mhm.
just to make sure. Yeah. So the day I got the cancer diagnosis, I was like, today I'm eating brie because I've done everything right.
Oh,
Now they tell me I have cancer.
oh,
I've
Mag,
done horrible drugs, and now today I'm eating brie.
good for you. Oh, the restrictions and the expectations that our society places on pregnant people, it's just, we have so much work to do.
But I was thinking, you're telling me it's okay for me to get chemo pregnant, but I can't eat brie? No way. I'm
Totally.
French. I'm eating brie.
You do you. Oh, Meg, thank you so much for sharing your story and for letting us know the wonderful happy ending that is your crawling 9-month-old baby girl.
Thank you. Thanks for having me. And I know this was really heavy and
Yeah.
I threw a lot of information, but I think I just want to let people know that if you're having a difficult pregnancy and if you're having a difficult time, that I feel for you, but also you can get through it. To me, it would really help. Somebody told me sometimes all you've got to do is make it through the next 30 seconds. And so seconds by seconds, minutes by minutes turns into weeks and months, and you can do it. Yeah, I hope this was helpful.
It will be. And we do have providers that listen to our podcast. And so I hope that just understanding the impact of words, right? And how powerful that is in our language.
Yeah. And sometimes as a provider, all we can do is have empathy and kindness.
Mm.
There are so many things that are out of our control,
Mhm.
as patients, but also as healthcare worker. Yes, we can make diagnosis. Yes, we can try treatment, but sometimes the biggest impact is the kindness and the support we can show patient. And believed in this very strongly even before I was a patient myself, but I can tell you this will never leave me now. It's
Mhm.
just so deeply rooted now that, and I hope never say never, right? We all have
Mhm.
moments where you're stressed, you're running around, you're not your best self.
Mhm.
But I hope that I can never make patient feel like I am minimizing or brushing off their concerns.
Yeah. Oh, Meg, what a truly inspirational story. And thank you so much for bravely sharing it with us today.
Thanks for having me.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.